Hi, I'm here today to get treated by Dr. Marshall. I plan on getting Lipo 400 and BBL. To be quite honest with you, I thought I'd be really anxious, but so far with the team that he has, they've made me feel really comfortable. So I don't even feel anxious, I feel great. They've made me feel confident going into this procedure. I've been contacted so many different times and I really appreciate that. They've been making sure that I feel comfortable, I'm prepared for the treatment. Overall, just a great experience. I've been feeling a bit insecure for about the past year or so, especially. Just been thinking about it for some time, did my research, and after seeing Dr. Marshall on social media, seeing his work, his experience, I instantly thought, okay, this is the time now that I found my surgeon.
Alright, so today I'm doing my standard case. It's a BBL with Lipo 400 and Lipo of the arms. So to start off, as always, we're going to start with the liposuction. But before I do that, I use something called tumescent solution, which is a clear fluid. And that has epinephrine and some pain medicine in. It helps make the lipo less bloody, but it also provides pain control for you during the procedure while you're asleep and post-op for about 8 to 12 hours. So that's the first part of all of these procedures, is putting the tumescent in around the fat. I'm often asked, do I use Vaser during my procedures? And the answer is yes. So after I put tumescent in, I like to use the Vaser because it does a couple things. One, it helps to separate the fat from the surrounding tissue. So when I put my suction cannula in, the fat comes out much smoother. It breaks the fat up into smaller particles, which when I then graft that fat into the hips, the buttocks, the breast, or the face, we get better uptake of the fat. But one of the main things it does is it allows for less traumatic removal of the fat, but it also takes a lot of work and pressure off my shoulders so that I can snatch you up even more. A lot of surgeons out here doing 1 or 2 liters of lipo, I'm taking you to the max. So one thing I like about Vaser Lipo is it does help to break up the fat into a smoother texture, so I'm not pulling out really large clumps. So here I have some of the fat that I've removed from the patient's abdomen, and so I'm just going to demonstrate kind of what it looks like as it's coming out here. So that fat is not super thick or clumpy. It's got a nice smooth texture to it, and that's thanks to the Vaser. So let's talk about definition of the abdomen with liposuction. You could get liposuction and just have a completely flat abdomen, and then whatever muscles you have underneath, those will start to show through depending on how much you've worked out. Some patients opt to have either low, moderate, or high definition lipo. There's multiple variations. In patients who are very fit, very athletic, and they have a lot of muscle as is, then sometimes we just want to carve those muscles and make it look even more athletic. But for patients who don't work out that often, I'm not going to put a six-pack on the abdomen when your legs and the rest of your body don't necessarily match. And so in a case like this, for example, we can do a little bit of light definition, and basically what that means is I take a little bit more fat along these what we call inscriptions, or areas where the muscle meets the fascia. And there's naturally a divot there. If I were to do a tummy tuck and lift this up, you would see where her obliques over here to the side, and then her rectus abdominis muscles are right here. And so there's always a small little line or inscription here in the middle, and then there's always one here on the side, and that's called the linea semilunaris. So that is definition in a nutshell. Alright, so I've completed the anterior portion of the Lipo 400, and that includes the anterior armpit, the side breast area, the sides or the flanks and the waist, the pubic area, the lower abdomen, and the upper abdomen. I like to do, in cases like this, just a little bit of light definition per the patient's request. So you can see a little bit of definition here in the midline, a little bit of definition here, and that just gives a little bit more of an athletic look to the abdomen. After I completed the liposuction of the front, got about 2 liters of fat out. That's usually on the low end for what I typically remove, but some people just have more or less subcutaneous fat than others. This is a good color of what we see when the fat comes out. It's kind of sometimes a yellowish color, or in this case, it's kind of has a slightish orange tint to it. That has to do with genetics and sometimes your diet. There's always some fluid that comes out with the lipo. Remember, I put a lot of tumescent fluid in. In this case, I put in over 3 liters, and most of that actually stays inside the body and you absorb it. That's why you have to pee a lot after liposuction. And so over the coming days, a lot of that fluid will leak out, and that's why we leave some of the incisions open to get all that extra fluid out. And that's why it's so important to get your massages to help with all that post-operative swelling. All right, so I just finished the arm lipo. So I did the right arm, the left arm, 4 areas on each part of the arm, and we got out about 1,000 cc's of lipo aspirate, and about 800 of that was fat. So, you know, I try to be fairly aggressive in the arms just to give you that nice, really good athletic contouring. So there's no magic number for how much fat needs to come out of the arms. Each person is different, but the goal is to get your arms as snatched as possible for this sleeveless, beautiful weather here in California, Florida, New York, Chicago, wherever you live. So let's talk about the difference between a slope and a shelf BBL. So a slope has more of a gentle transition from the mid back to the lower back to the buttocks. A shelf tends to have more of a very sharp transition from the lower back to the buttocks. Everybody has a slightly different preference. The way I approach it is when someone asks for a slope, then I need to leave a little bit more fat on the lower back to give more of a slow creeping transition. So the difference mainly for me is how much fat I remove from the lower back. With the slope, leave more fat. With anything else, I'm really carving this out to give more of that shelf look. So what is a natural BBL? Well, there's nothing more natural than what you were born with, your God-given buttocks. But one of the most common requests I get now is, Dr. Marshall, I still want to look natural. And I think that's completely fine. So a natural is when someone looks at you, they're not going to say that's for sure a BBL. It's going to be something that really molds and blends with your body, and it looks like you could have obtained that in the gym. On the other hand, I have some patients come and ask for what's called a disrespectful BBL. And you say, well, what does disrespectful mean? Well, it's almost like when you walk in the room with that disrespectful body, other women feel offended to some degree because that thing looks so dang good. Now, I love when women applaud other women, but it's very common for people to look at you and be like, dang, I should have gone to her surgeon. I'm right here, baby. You know where to find me. All right, so all finished. My signature Lipo 400, lipo of the arms with Vaser and BBL. So the patient today, she desired more hips and she desired more of a slope appearance. So we have more of a gradual takeoff from the lower back to the buttocks, as opposed to a shelf where it's going to be more of an acute angle. So that gives it more of a natural look and feel. So Lipo 400, that's lipo of the entire front, including the armpits, the bra roll, the entire back. And then we added on the arms and did a mildly disrespectful Dre Sculpt BBL.